Joining me now from Washington, D.C., Senator Rand Paul. Senator, thank you so much for joining us. Senator, I want to remind our audience here that you're a doctor. You also had coronavirus, you recovered, and then after you recovered, you went to a hospital, volunteered, and helped treat coronavirus patients. So you obviously see COVID-19 a lot differently than maybe some of the folks in the media that don't know anything about it, don't really know anything about the science. They say it's all about the science, but they don't know anything about science. But what we're seeing right now, we're seeing a surge in cases. We're seeing the very restrictive lockdowns from state to state. What's your reaction to everything that's happening right now?
You know, I've said for a long time that people on the left say to us on the right, look at the science, look at the evidence. And so I've agreed. Let's look at the evidence and look at the science, but let's really have a discussion and a real debate about this. So about 6 months ago, I said to Dr. Fauci in committee hearing, I said the data from 4 different countrywide studies with contact tracing shows that kids are not transmitting this to their parents or to the teachers. It has a very low transmission rate from kids to adults. The kids are surviving and doing very well. And when the kids go back to school, there isn't a surge. And we showed him charts and graphs from about 6 different countries. And he went off on some tangent and said, oh, what about Kawasaki's disease or something, which is a syndrome and it's rare, but is something that also shouldn't be deciding whether we're back in school. The American Pediatric Association said kids should be back in school. For 6 months, we've been telling Dr. Fauci this, and yet they've looked the other way. He finally now accepts that we should go back to school. Interestingly, even de Blasio, the socialist de Blasio in New York, says kids should go back to school. But the Democrat governor in my state, Bashir, is still he just closed the school. So some people just aren't getting it. But yes, we should look at the science.
Yeah, I'm sure you saw this story making headlines of the bar owner in Staten Island who was arrested for breaking the COVID restrictions. I sit here and I watch and my blood's boiling, seeing how these business owners have been treated just because of the arbitrary rules. It's not like those of us who are against these restrictions want people to get sick or want the coronavirus to spread, but we also care about our freedom. And then we also see all of these lawmakers who are enforcing these rules and voting for the bans and lockdowns. They can't even follow their own rules. So hundreds of people showed up and supported this bar owner. He gets arrested. I mean, what would you recommend to these businesses that really have no options right now?
You know, when Hayek wrote The Road to Serfdom, he talked about government that was, a corrupt government or intolerable government was one that was arbitrary and capricious. And that's what these rules are, completely arbitrary and capricious. This bar, you can go 2 blocks over and a bar's open 2 blocks away. And the guy's like, what, the virus doesn't go across the block? And I just love to see the pushback of these guys, working class guys, union guys in New York who say, I want to go have a beer at my local pub and I can't go here, but I can go 2 blocks over. That makes no sense. There's no science behind it. It's completely arbitrary. And that's the definition of an unjust law, is a law that's completely arbitrary. And this is happening across the country. In a broader sense, if we look at when the mask mandates were instituted in many different states and countries, the incidence of the infection continued to rise, if not explode. It's showing that most of the things that we are doing are having no effect on the virus. I think the only thing that will is a vaccine, frankly, and we shouldn't take our eye off of the prize. We shouldn't say, oh, just wash your hands and wear a cloth mask, which don't work, and say, oh, you'll be fine. No, we should be saying to our elderly, I think it's probably time to go get the vaccine, to doctors and nurses. And I think you're going to find when the first 5 million people who really need it go out and get it and do well, that most of the rest of the public will probably follow and get it as well.
Yeah, again, if you follow the science, obviously the lockdowns haven't been working, the masks haven't been working. You talk to people who've been staying at home, not leaving their house, wearing masks at home, they still get COVID. I mean, eventually all of us are going to run into COVID-19 somewhere, whether it's the gas station or going to the supermarket or picking up your prescription. Can people actually hide from the virus?
Yeah, no, and I think it's kind of strange in a way. So my wife has been exposed to me for a week when I had it, and she didn't get it. She's been exposed 4 other times with a driver who had it an hour in the car with the driver, and with somebody at Bridge, all these different places she's been exposed and hasn't gotten it, and we don't understand why. But then I talked to a woman yesterday who went to a dinner party with brothers and sisters, and they all got it. Everybody got it at one dinner party. You hear those things at a birthday party or choir practice. So sometimes it seems incredibly infectious, and then other times it's perplexing why some people don't get it at all. I think it has to do with immunity, and they've talked about this with kids. There's a cross-reactivity between coronavirus colds and coronavirus COVID. And so what you find is when you test the blood of children, 43% of kids have antibodies to coronavirus colds, which in all likelihood is cross-reacting and giving them some protection. And I think adults have some of it too, just not as much as kids.
Yeah, you were talking about your back and forth with Dr. Fauci here when it comes to getting kids in schools, and you were criticized for coming out and saying that, the science shows that it's okay to send kids back to school. It's actually probably more damaging to keep them at home. Not only is it tough for the parents, but also just like the mental health of children, and there's just so many consequences. So when we have these health experts and officials like Dr. Fauci who change their minds every other day, how are Americans supposed to take that? So it's like we're supposed to listen to you, but then you change your rules every other day. For example, when we were initially told that we didn't need to wear masks, and then all of a sudden now they want you to wear masks outdoors, alone, or even in your house.
See, I think the biggest and most important lesson from this is that you shouldn't centralize decision making. So, for example, Dr. Fauci's probably well-intended, and he has one opinion. Dr. Atlas, who I greatly respect, has another opinion. What should happen in a free society is you're free to listen to both of them. It's kind of like the news. You get both sides on the news, and then you're supposed to be free to make up your own mind. It's the same with this. People have differing opinions on what works and what doesn't work. And I trust the American people to be smart enough to figure this out on their own. But what we're living in is a world, a cancel culture world, where, it's decided. The science is decided. The scientific consensus is there. And how dare you be a heretic and challenge the scientific consensus? Well, it turns out the consensus has been wrong, frankly, and now they're admitting they were wrong on schools. I think they're eventually going to admit they were wrong on bars and things. One of the interesting things that nobody's talking about is the death rate in New York is almost zero. It's right along the x-axis and has been ever since April and May. Why do you think that is so? People are saying, oh, because they wash their hands and they wear masks. Well, they wash their hands and wear masks everywhere in the United States, even in places where the infections are going through the roof. It's more complicated than that. And I think what happened in New York is they had a horrible death curve, a horrible mountain of people who died very quickly in April and May. And I think the community has some immunity, not perfect immunity, but enough immunity that they've slowed down the death toll in New York, because now many of the vulnerable, probably most of the nursing homes, Cuomo made a big mistake. But the thing is the bottom line, so many people died, but those who survived probably have already had COVID in the nursing homes in New York. And so that we're seeing less deaths now. But nobody will discuss that, because it's all about wear your mask, be a sheep, do what you're told.
Yeah. Well, and in some of these states, like at 10 p.m., they want you to go home. Now we have curfews because apparently the virus runs loose right at 10:01.
Yeah, virus gets out after 10 o'clock. The virus does not go to protest if they're approved by the left wing. So Antifa, you've never heard of a case of any Antifa person getting one when they're trying to burn down City Hall. But it's just ridiculous stuff like that. And people are seeing through it. So the local guy on Staten Island wants to go to his usual pub for a beer, is seeing these people out there breaking windows and hearing people saying, well, if they're rioting for and looting for a just cause, they probably won't get, COVID. Well, that's ridiculous. And people are seeing it as ridiculous. And it's not that we're saying this isn't serious. Look, I have good friends who are in the hospital. A doctor in my town died. We have another friend who's very sick now. And, we pray for them every day to heal. So we know it's a serious disease, but we want to do what works and not just tell everybody to do stuff that's not working. So, for example, if you want to protect the elderly, you should tell them cloth masks don't work. The N95 masks actually probably do. There isn't any statistics to show that they've worked nationwide, but if you are elderly or sick and you have to be on a plane or you have to be with people for several hours and you don't have a choice, the N95 mask is actually pretty effective. The cloth mask lets 97% of virus-sized particles go through the mask. So the cloth mask is more theater than it is actual benefit.
Yeah. What did you make of the CDC director saying that the next 3 months are going to be the most difficult and challenging in public health history? Why would that be?
I don't think we know yet. We have a huge surge in people who have positive tests going on right now, and we do have a surge in those dying. Now, the overall death rate is much lower than it was in the spring. If we had the same death rate, we would be having 10 to 15,000 people die every day, which is horrific. It's bad enough what we have, but it's actually much lower on a percentage basis than it was in the spring. I don't know. Some of the statistics look like we may be cresting, that the top peak incidence, this may be through. Now, could we come back and have an even higher incidence? Maybe. Or it could be that we get to the other side of this. And, they make fun of the president when he said, oh, well, virus may disappear. Well, the history of the Spanish flu and every other terrible virus, not every other one, some return, but many of them return and are never as bad. The Spanish flu has come back in other variants, the specific influenza bug, but never as bad as 1918. And so there is a time that even naturally, and I hope the vaccine will speed this up, but even naturally, there will be a time at which we crest this and it doesn't get progressively worse. So the ones who say the sky is falling, they don't know that. I think we should be careful and try to do the best we can to protect the vulnerable, but we should do what works. And if something doesn't work, we should be honest enough to admit to the American people what we're doing is not working.
Yeah, absolutely. All great points, Senator. We appreciate you and your time. Thank you.
Thank you.